Yes, in the back.
Dr. Sachs acknowledged the politics around this issue, and I just wondered if he would elaborate on how he plans, with the support of many others in this room, to navigate through what might be an interesting political response within, let's say, right here in Washington, as well as other places. Just curious of how that outreach and communication will unfold in the weeks ahead.
Jeff, this question is for you. It relates to the politicization of this issue and the challenges of moving a report of this sort forward in the context of the kind of political opposition that may entail. What are your thoughts in terms of how you will make this report resonate with the right audiences?
Well, some of that is a bit of a mystery, I have to say. But what I mentioned briefly in my remarks is that this agenda, I think, is actually being revived in a number of places in the world, and I'm hearing in the African context we're working very hard, and where the maternal mortality rates remain shockingly high, where the fertility rates remain astoundingly high, and the mortality rates of children remain astoundingly high. And of course, in the context of AIDS, that sexual and reproductive health services are coming back to the fore in much more explicit discussions than I can remember just a few years ago. As I mentioned, I was at just a context in Senegal, for example, I was at a cabinet meeting about 3 months ago, where population policy and sexual and reproductive health services were really at the forefront of the discussion. I was quite surprised, frankly. I hadn't heard it before, but since then, we've now, in our work as advising countries on national development strategies to achieve the MDGs, we're finding a significant number of countries picking this agenda up. And our report is not only meant for Washington and our local politics, it's meant for the whole world. It will be distributed widely among the member governments of the United Nations. It will certainly play into discussions that will be underway all throughout 2006 on the design of national development strategies. So I actually think we're going to get a very good hearing on this. One of the things, by the way, that the people are beginning to understand better is the relationship of issues of maternal mortality, for example, and the kind of sexual and reproductive health services discussed throughout the report. And so since maternal mortality is front and center in the Millennium Development Goals, this also is an automatic segue for this agenda to be there. What's clear, by the way, just to conclude, we're hoping for as much partnership of our own government on all of these issues as possible, but politics is global. We need political mobilization in all parts of the world. It's not determined by a single government or a single administration. And so getting the news out very broadly is absolutely essential, and that's what we intend to do with this report.
Let me just add one thing to that. The people in this room, the people who wrote this report, the people who are here for this Global Health Council annual conference are scientists and public health professionals. They base their conclusions and their actions on facts and evidence. That's our job. They are not ideologues or polemicists, and I think that the way that we have to address these issues is to calmly and clearly make evident that those who would politicize family planning and contraception do so at the cost of women's lives in impoverished societies. This is the goal that we have to be working for, and we can't be drawn into a he said, they said kind of debate. Next question, please. Yes.
My name is AGK from Nigeria, IFAS Nigeria. I would first of all want to congratulate the project for bringing safe abortion to the fore in terms of what's going on, especially in places like my country, where politicians have completely ignored the contribution of complications of unsafe abortion. Now, the other aspect I would like to also comment on is in terms of population dynamics. In a place like Nigeria, the people who are supposed to get this information are getting mixed messages. On one part, the politicians are telling them that when you're going to be counted, you just had a census. People are told that it is important that you have a lot of people because that's how we share resources in the country. On one side, developing partners are telling the people you need to limit your family size. On the other part, religion is playing a part. You come as an international donor agency, they say the Americans have come to reduce our population. So it becomes a very big problem for the common person that's living in my country. Who does she believe uses the woman? If it's the man that has to make a decision, even for the woman, who does he believe? So I think this is one of the compelling challenges we need to be looking at in the future to be able to manage it.
Okay, if I may, just on one or two of these points, the report recognizes the enormous public health burden that unsafe abortion contributes to maternal death. It accounts for some 13% of maternal death globally. And this is something that countries have to deal with. They have to inspect the situation of public health in their countries, the situation of the access and availability of services. They have to consult their values, their culture, and make the decision that is right for the public health needs and individual people in their country, consistent with their values, and they all value avoiding deaths. So I think this is something that has to be left to national dialogue, to national decision, recognizing that these national decisions have strong public health implications. Every religion accepts some form of family planning or other. This again is a question where the cultural values and particular priorities that are placed will be very important. You mentioned the issue, key is to who makes the decision. The report emphasizes that improved communication between men and women and mutual support for collective decisions will be an essential part of progress here. There is much more agreement about family size desires within families than there is disagreement in most parts of the world. But because it is an unspoken agreement, it is not acted on. We hope that the widespread publicity of the report will intensify that dialogue and make it a more real decision related to personal choices within the families. These larger issues on how large is a country compared to a neighboring country, I don't think people make their personal life decisions on those sorts of predicates. An enhanced dialogue, a deeper concern and mutual respect can see us through these problems.
Yes, I would like to highlight again that from a public health perspective, unsafe abortion is one of the priority sexual and reproductive health problems, and that we should certainly address it. There are many ways to do it, even under the difficult environment we are facing these days, both here and in many of the countries where unsafe abortion is one of the leading causes of maternal morbidity and mortality. And I know about the great work of IPAS and the brave work in the countries where you're present. In terms of the contradictory messages women get, yes, although I agree with what Stan said, I also agree with your comment, and I think it's important. Too often, the communities and families we address get messages that are not clear to them, or that are, as you said, contradictory. And we, as development actors, should make a very, very strong proactive effort to bring clear and consistent messages to women and families in developing countries. That's why dialogues like the one we are having here today are so important.